not going to see all these bright colors, but for learning, it's valuable because the blue refers to deoxygenated blood that's going back to the heart. The red refers to oxygenated blood that's being pumped under pressure. So typically, these large vessels are going to be arteries, and the large blue ones are going to be veins. Now, when they're really small, we call them venules because venules are going to join like a river to form a vein. Arteries are going to branch into arterioles and capillaries, which are almost like spider webs. They're so small. Let's look at, a lot of these words are familiar because we know what cephalic means. We know about the carotid foramen in the skull. We know that axillary means armpit, brachial means arm, radial means a radius bone and ulnar. So a lot of these words should sound familiar, we hope. So left ventricle, blood is pumped. Now the heart's greedy, so it feeds itself first with the coronaries. The next one that gets it is this brachiocephalic. Brachii means arm, so it goes eventually go to the arm. Cephalic means head. So brachiocephalic, and the first branch of that is going to be the right carotid, because this is your patient's right side. No matter how you're looking at it, it's the patient's right side. So right carotid, going to the brain, and this is the right subclavian. Sub means under, clavian means clavicle. So it's going under the clavicle. Then the other branch is the left common carotid. The word common means it's shared, and it's going to branch. Because the brain's pretty greedy. It doesn't trust just one big artery. It wants a second artery feeding it. And then on the left side of the patient is the left subclavian that's going to branch here. Let me take it on this side. The first branch is going to be the cephalic. The cephalic goes all the way down, and we palpated that, if you guys remember, on the thumb side. The cephalic. Once it branches, it gets a new name. So we're near the armpit. It goes from being called the subclavian to the axillary. Just like street names, you know, one street name can change depending on where you are on that street. Same thing here. So right subclavian becomes axillary in the armpit. You go a little further, now it's brachial because it's in the arm region. Brachii means arm. And then it's going to branch again. If it goes to the thumb side, that's going to be the radial artery because of the radius. It follows the radius bone. If it branches towards the ulna, we have the ulnar, and then it goes into the palmar arch. The blood vessels coming back are blue, and those are going to be veins. And a lot of their names are similar or the same as the arteries, so we're not going to learn those here. Now the blood doesn't just stop because it's going to go from the ascending aorta to behind the heart, and it comes out right here. So here, at this point, it's called thoracic. This is the thoracic aorta. That's the ascending. Now, a lot's going to happen right here because we have the organs of the stomach and the spleen that are going to come from what's called the celiac trunk. Celiac trunk. And this is kind of hard. You know, on a test, I'm not sure how I would do this, but the celiac trunk's at the base, and it branches into gastric, which looks like a dead end, but really imagine the stomach's right here. They didn't put the stomach here because it would block the other organs. So the celiac's going to branch into the gastric for the stomach and the splenic, because that's the spleen right there. Yeah. Then the other branch is the hepatic, because hepatic refers to liver. So hepatic portal sometimes, or hepatic artery here, keeping the liver alive. Then we go down a little bit further, and now we have the renal arteries going into the kidneys. Renal refers to kidney. And then there's a renal vein coming back out of the kidney. Once we drop below the kidneys, it's no longer the thoracic, and now it's called it's now called the abdominal aorta. And for some reason, a lot of people develop aneurysms here because the walls kind of are thin, and a little ballooning happens, and you don't even know you have it sometimes. Okay, there's some mesenteric arteries here we're not going to worry about. But now we have the common iliac. Remember, common means it's going to branch. And it branches into the internal iliac, which kind of dives down. On cadaver, you won't see very well. you might just get a little peek of part of it. And the main one that we see is the external iliac. So that's kind of a new word. You know, we haven't really had iliac yet. But think of legs for iliac. And we're on this side. It's going to get near the femur. See, this is the femoral bone. And so we're going to call this the femoral artery. Once we get to the knee, then we get this busy collection of blood vessels called the popliteal artery, popliteal. And from here it's going to branch. It's either going to go down the front of the tibia, and so a technical name for that is anterior tibial artery, or it's going to go along the fibula, which is a small bone, and we call that the fibular artery. And on the top of the foot, we have what's called the dorsal artery of the foot, or the old name is dorsalis pedis. And you get 2 fingers in there on a patient, and you can palpate a pulse and determine, like, let's say they've been in an accident and there's an injury here, we can determine if blood is flowing to the foot. So it's really useful in medicine, dorsalis pedis. To get the blood back to the heart, we have many different veins. A very important one is called the great saphenous, and it goes all along the medial aspect of the leg. And some surgeons in emergencies will take part of the great saphenous and do a bypass, because if this one's clipped, there's other veins that can pick up that workload. So the great saphenous all the way up here to the inferior vena cava, and the inferior vena cava eventually into the right atrium of the heart. Questions? Okay, now I know that seems like a lot, but